Thank you, Jill.
Hi everybody, and thank you for staying for the last session. Oops. I think this is the second time I've done the last session in 2 weeks, so I'm not sure what that really means. And I do have my card, and I really think I should get 2 hours. Because imagine what we could talk about with the workforce coverage. If I could talk to Child for 2 hours, that would be fantastic. So I might just get that in the box just in case. But anyway, hey, thank you very much for the opportunity. Thank you, Catherine, for inviting me to come and speak. And it's kind of funny, I'm here to talk about the qualifications review, and you can all read the quote from our Prime Minister about what he wants to have happen. But I was just reflecting on the fact that there's some people in the audience here who were at the very first meeting we had, so thank you for Maurice and Chris and from other people from the Disability Support Network who participated in a meeting in Auckland maybe about 6 weeks ago. And I was just reflecting how far this conversation has gone before our qualification review starts on the 2nd of May. So it has gone through quite a long, not a long process, a really enjoyable process that I've been involved with in talking to, I would say, over 700 people in a face-to-face way where I've had lots of feedback. So that doesn't count the times when I've sat up in front of a conference and just talked. We're going to do a little bit of both. We've got a little bit of time, so I do have the opportunity, and I'm hoping you're feeling like putting out your pen to some paper and talking to the people next to you and actually giving us a little bit of feedback just before we hit this qualifications. He's already got his pen out and he's clicking it already. So anyway, the qualifications review, for some of you who, I'm guessing there might be one person in the room who we haven't connected up with who has no idea what I'm talking about, which is fine. So the government would like to reduce the qualifications on the New Zealand qualifications framework down from the 4,600 to about 1,200. I think we're down into the 3,000 now already. And if you can see down the bottom there in that fine print, it's saying that English as a second language used to have 274 qualifications on the framework. They will have 7. And cookery, for all those people into cooking, I think there used to be 74, and they'll have 4. So the qualifications framework is about reducing the duplication of qualifications on the framework. It's a New Zealand exercise. This isn't Careerforce doing it to you. This is definitely something that everybody who has qualifications on the framework between levels 1 and 6 is in the process of doing. So that's all the trades, all of our sectors, the hairdressers, you name it, all those qualifications. So a little bit of background just to get everyone on the same page really quickly, and then we'll get into the exercise. We are fortunate in that we get quite a unique qualifications review to be involved with. We've got a double stream going to happen. So one stream in our qualifications review is going to be led by NZQA Mataranga Māori and a directorate from the Ministry of Health, and they will be reviewing what's called the whānau ora stream, and that includes all the Hauora Māori qualifications as well. And then the other stream that we have is the one that Careerforce has been asked to take the lead on, and we will be reviewing all the qualifications on the framework around health, disability and social services. And yes, that does include Māori as well. So that's kind of how the split works. And if you can imagine, the way we think it's going to work, because it's a very fluid process, is we've got 2 streams that keep on reconnecting to make sure that we're not duplicating a qualification that we're busy about to write. So that's kind of the big picture of how it works. The outcomes, we might as well get right to the end. So this is one of those conversations where I have to tell you everything is going to change. And the first thing I've been saying, just to make sure that we're all clear right from the start, is that we are not going to make you all happy. Someone is going to be really grumpy with us at the end of the process, because if you sit and think about all the diversity of views that you have in this room, and then you multiply that by thinking about who are we talking about here. We're talking about our clients, and our clients go from newborn hearing screening to palliative care, death and dying. So actually our clients are everybody in New Zealand, and I just don't think it's possible, no matter how well we do it, that we'll actually have everybody, absolutely everybody happy. So what we're going to be looking for is common ground, shared understanding, and what we're really trying to do in this process is have you understand what it's all about, so then when we ask for your feedback, you kind of understand what we're trying to achieve and go, okay, well, what can I live with? What's okay? What's acceptable and what's better than acceptable? And what am I really unhappy with that I need to get back to the review about? So we know that what we also do is we end up with a new suite of qualifications. So I don't know if you could visualise what our current qualifications look like on the framework. It's kind of, there's one at level 2, there's quite a few at level 3, there's a huge amount at level 4, there's some at level 5 and there's some at level 6, and they're kind of just plotted. They don't actually flow like a pathway of qualifications would. They're kind of just all over the place, and they don't actually relate with one relating to another. We've got a couple of examples where our level 2 does go to a level 3, but not generally. Most of the qualifications have been built kind of in isolation from each other. So we know we're going to end up with a new suite of qualifications, and thankfully a suite of qualifications is as simple as it sounds. It's just showing how the qualifications interrelate with each other. So that's not a hard picture, that's the easy bit. What else do we have as outcomes as part of this review? We know that we're starting with 83 qualifications on the framework. So Careerforce manages currently 38 of those qualifications. So when we're talking about the other stakeholders in this, you are all of our stakeholders, but also all of the education providers are mandatory stakeholders in this process. So the polytechnics, the private training enterprises, the wānanga are all part of this, and they're the people who own the rest of the 83 qualifications. So we know that we've got 83 qualifications, and again we're a little bit special because we like to, you know, do things just a little bit differently. What we get to do, we're going to reduce the number of qualifications, so we're going to take the 83 down to something, but at the same time we're going to make sure that we fill the gaps that we've never filled before. So we know that there's training that's required for our workforce that currently does not have a qualification associated to it. And a couple of examples would be, we don't actually have anything on the framework around behaviour support up at a high level. We don't have anything to support autism. We have very little on peer support. We have very little on child protection of vulnerable children. So we have some very big gaps that we want to cover off when we're doing this review. The other thing, as I said, everything changes, so the outcome of this is they all end up being New Zealand qualifications. So you're going to get the New Zealand certificate in or the New Zealand diploma. And all the people from when this process starts, or when it's there and available, they're going to end up with a New Zealand something, which is kind of good. And these qualifications belong to all of us, New Zealanders. They don't belong to education providers anymore. They don't belong to Careerforce. They're actually going to belong to all of us. So they're going to be the New Zealand something. Don't know what yet. So just when you thought you'd heard enough about change, there's another change on the horizon as well. So we might as well get them all over and done with really quickly, these changes. So what else happens? We're going to get a new qualification suite, but we're also, they've changed the way you write a qualification, and this is good news. The way you now write a qualification is you talk about a graduate outcome. And you talk about a graduate outcome in terms of the sense of what can a person do, what do they know, and who can they be. And it's really high level. So you're just imagining that we're not going to get down into this little bit of detail about whether they cross their I and, no, they don't cross an I, do they? Cross that T and dotted an I. We're not going to go to that level anymore. We're actually going to keep it up at this high level and say, what can that person do? What do they know? Who can they be? And you describe the graduate outcomes, and that's how the qualification gets described going forward. So that's one very significant change. The other thing that we do is we end up with sorting out, finally, for the first time ever, the education and employment pathways that relate to these qualifications. So I'm looking forward to the day that I go to a careers advisor in a school with a little poster that says, hey, guess what, guys? Your students can actually come and work in our workforce because we can explain where they can go, how they can start, and where they can lead on to. You can't do that at the moment. It's far too complicated, and I don't think our workforces get recognised in the school system very much at all. We don't get talked about because we haven't been able to give the schools a simple way of describing who we are, what we do, and the amazing work that's out there. Because we're complicated, so we're going to decomplicate and have that poster. So the day you see me waving a poster around is the day that you'll know that I'm probably think I've finished and I can probably move on and do something else. But it's really important, I think, that the outcome is we can go into those schools and tell these students, you know, what this world's like and how neat it is to work in it. The other thing that happens in this review, you have shades of grey. The school system itself is going through a review, and they've got vocational pathways. I don't know how many people here have got students, sons and daughters doing NCEA level 1, level 2, level 3, and me. So what happens is, and I've seen this happen because my son did it, it's a mother's worst nightmare in some cases depending on what they do, but anyway, they pick their subjects, right, at school. So they might do this in our old 4th form or year 9, 10? 10, thank you. So they pick these subjects, and then they can plot these subjects onto this really cool little matrix, and it shows them what they're picking their future to be. And if they pick their subjects really widely, they can go anywhere. But if they pick their subjects into a really narrow field, it shows them that that's where they're headed. So they don't get the surprise once they come out of the school system that that's where they're headed. They actually know beforehand. And sometimes as a mum, you might want to encourage your son that maybe he could just have a slightly wider view of the world, and maybe he doesn't want to go straight down that path. But then as a mum, as most mums would know, you're not actually going to have that much effect on what your son's going to choose, and he's going to go down that path and do that thing, but at least we all know that that's where he's headed. So you've got these vocational pathways sitting here, and then you've got the review of the qualifications from level 1 to level 6, which is the part we're doing. And then, of course, we say and what's happening with all of the bachelors and the university programs and the level 7s and above. Well, if we're figuring out what the pathway is, we must be figuring out what the relationship is between these qualifications we're about to review and moving into those pathways further down the track. So they're outside of the review, but they're kind of within the scope of thinking about it and thinking about pathways. So, yet more change. As I said, let's get this change out really quickly, so I'll talk even faster if you like. But what happens is you've got New Zealand certificate in something, and then underneath that you've got programs. And again, this is good, because these programs can be contextualised differently. So Careerforce might develop a program, your local wānanga might develop a program, your PTE might develop a program, and your Polytechnic might develop a program. Those programs all obviously need to meet the graduate outcomes of the New Zealand certificate or the New Zealand diploma, but they're not putting us in a box and telling us we all have to jump to the left 3 times and that's how we're going to do it. They're actually allowing us to have that flexibility at the program level to make sure it works and it's meaningful and it fits your region or it fits clients. So that's okay, we can live with that. To get onto the framework, NZQA needs to make sure that these qualifications are significantly different from each other. They also wanted to make sure that we have evidence need. So we have to prove to them that you want them. And as part of that, as stakeholders, you have to tell us we've done a good job, and we have to give that feedback back to NZQA to say the majority of stakeholders are really happy with the outcome. So it won't go through if you're not happy, okay? You're a big part of this conversation. The other thing that we must do, because of course a lot of people straight away worry about, what about my existing qualification? We have to figure out the equivalencies and the transitions. And if you've got people in training right now, please don't stop training, because you're about to hear that this isn't going to happen tomorrow. Well, it sort of is going to start happening tomorrow, but it won't be finished tomorrow. So you keep on training, and we will work out the equivalencies, and we will work out the transitions for existing qualifications. Nearly done on this part, and then we can get on to something else. So in terms of, as I was saying, I think I've probably done maybe 30, I'm not really counting how many meetings, and been engaged with people and trying to get feedback, and it has shifted quite a bit. There'll be some language here I know I wasn't talking about a month ago. What's amazed us is the willingness and the keenness and the positivity that we've received in the feedback and the conversations that we've had. It's been fantastic. So one of the changes that's occurred is we've now got advisory networks, because we've had so many people say not only will they do the consultation when it comes out, but they want to be more involved in that. So if you go to our website, and the final slide has our website, but if you put Careerforce into Google, it'll come up with the Defence Force first, and then it probably will come up with us second. So write in Careerforce and you'll find us pretty easily. But you can go onto our website and you kind of click on the button with your mouse, of course, and you can put an application form together to join an advisory network. And the application form's just your name and your email address and how we get hold of you. It's not any details beyond that really, so it's very easy. In terms of the advisory network, what that means is that you're going to be linked in to someone who's on the working group, you know, the people who are doing all the work. You're going to have a direct link into them, and they're going to ask you questions and want feedback. And we encourage you to join an advisory network if you want to influence the outcome. That's where you do that. That's where we have to hear the little voices as well as the big voices. So you might want to make a note to think, yeah, I might go and have a look at that website and get on one of those advisory networks. And it gives you a choice as to which network or networks you might want to choose. And the reason we've done that, because we've kind of added another layer of engagement, is because so many people have said, well, I don't want to wait for the consultation, I want to know what's happening as we move along. The other thing that is the most exciting thing of this whole process is that we've been asking people, what would you like to have the suite of qualifications underpinned by? What's really important to you? In fact, what's the most important thing to you? And you're probably not surprised, and you've read it already, I know, but to get that feedback from so many people saying they want it to be about the clients, and they don't say clients necessarily. We've had service users and tangata whaora and all sorts of different descriptions of the client and the patient, because it depends which sector you're in as to what you've been saying. But they're all saying it should be about the person we're supporting, and then their family whānau, and then a lot of people said, and then their community, and that's what should underpin it. And so that's what will underpin it. And the little exercise we're going to do, you'll see how we're now actually turning that into being meaningful. So what they could have said when we asked that questions, they could have said, base it on the contracts that are out there, base it on the sectors that we work in, base it on the settings that we're in, but they didn't. They've gone whole person being supported, family, whānau, community, their whole life's journey. They've also said a lot, and it's not up there, interconnectedness, and so it really resonates with all the conversations that have been had today about this connecting it all together. So it's kind of neat really, because now you're going to look after me, and I've got a disability and I've also got an addiction, and damn it, I've now gone and broken my leg. You're going to treat me as a whole person, as all of that. Now it doesn't mean, of course, we're going to end up with every worker being able to support every need that I have, because there's different levels of support. But at least I'm going to be treated as a whole person rather than kind of being split and divided, and you know, that arm, I can only talk to that worker about that arm, and that, and etc. So it's really exciting that what we're underpinning our qualification suite is going to be about people, whole people and their family whānau. The only other thing I can really tell, because we're not allowed to predetermine the outcome of the review, we have to wait for the process to happen, so I've got a bit of a feel for what it might look like now. But one thing that's come through pretty strongly is that there are likely to be common competencies across all the levels, obviously different at each level, but for example, communication comes up all the time as being a competency that we need to improve our skills in. Another one that's coming up is critical thinking, and people are saying start critical thinking much earlier on in the levels at an appropriate way, but let's have critical thinking being part of the conversation at level 2 and level 3 and level 4 and level 5 and level 6. Another one, last example, would be recognising change. People have been saying if we could have the workforce recognise change faster and know what to do about it, we could probably prevent some things escalating much quicker. So that's just an example of what some common competencies might look like. So what's the process? Client maps, that's the exercise we're about to do in a minute. Here's the simple process, keeping it really easy. Stage 1, we build the suite of quals, and we come out and ask you what you think of them. Then they stop as a draft suite, because then we go into stage 2. Stage 2, we write the qualifications. Maybe 10, maybe 20, maybe 6, who knows, but we write them. Then we come out and ask you what you think of them. And you have to tell us you're pretty happy, generally speaking, and that some of you are going to say they're fantastic. That's the process, stage 1, stage 2. Now that process there is only that very first box closest to me. That's what they call the application to develop. And this is why it's not going to happen this year in terms of finishing it. So we get till 2nd of May, 30th of September to do stage 1 and stage 2. You got a sense of how fast it's going to be once we hit the road on the 2nd of May? So stage 1, stage 2, all done 30th September. What that means is the applications to NZQA to develop the qualifications goes to NZQA and about that much paperwork to justify it all, maybe that much. Then what happens, NZQA has a look at it and they go, sorry guys, you wanted to have that frontline manager qual, but business have already done that qual. You have to use the business qual for frontline management. You can't have your own. Let's hope they've written it really well. So then NZQA look at what you've done and say, yep, they're all good, but no, or they're all good, but we don't think you've evidence need for those two. Give us more evidence of need. Then, but of course that won't happen to us. So they'll go straight through. NZQA will say they're fantastic. Then what we have to do is we actually have to put the package together to apply for the qualification. So that those applications then go back to NZQA, and of course they will be fantastic, and NZQA will just love them, and they will sign off on them, and they'll end up going on the framework. So they'll go onto the New Zealand Qualifications Framework, and they'll be there. And the minute they're there, that lets all the program developers, so Careerforce, your Wānanga, your local polytechnic, your local PTE, they then develop the programs, and then you get to use them. So you can understand why actually nothing's going to happen this year in terms of a change in the qualifications that your staff and our students, etc. can use. And we're going to have to prioritise and determine which ones do we write programs for first, etc. So keep on keeping on. Now I have a feeling, this is it. So this client, we talk about, well, we're going to come from a client perspective, but what are we going to do differently in that case? So what we'd like you to do today is to stay where you are, make sure that someone's got a pen, one between 2 or one between 3, definitely work in pairs because you've got to chat lots when you do this. What we'd like you to do is build some client scenarios for us, and we're going to give you one example on the piece of paper, and you don't need to spend very long, but we've just got a sense that we perhaps don't know what all the client scenarios are out there, and we might be missing something. I had a list and I've lost it. Just to give you an idea of the conversations that I've been in this week, or will have been in by the time I leave Wellington at lunchtime tomorrow. So, health promotion, client scenarios about health promotion, child protection, screening, peer support, hospice, smoking cessation, hearing therapy, needs assessment, disability information provision, practice assistance, family carers, volunteers, brain injury, spinal, all the ACC field, retirement villages, dementia, the Consumers Consortium, trainees, public health. So that's been my week this week. It's been a fantastic week. I'm really lucky to have actually been in conversations where people have been building client scenarios, but that's the field they've come from. I've probably left someone off, and I'm sorry if I have. So what we'd like you to do is think about a client group that you know really well. And it's not one person on their own. It needs to be, we don't need thousands of these. We want to end up with about 30 or 40 all up across health, disability, social services. Think about a client group that you know well, and in about 5 or 6 bullet points, just describe that client group. Then your challenges in 10 bullet points or less, describe the skills that are needed by a worker in order to be able to support that client group. So you'll see on the piece of paper that's being handed around now, there's actually some more sections to the client map, but we don't want you to carry on and do any more than that. What we're really keen to do is to get your perspectives on some client scenarios. You can do more than one, but let's find out some of those clients that perhaps we've missed so far. And I think we've probably got about 8 minutes. But it's because you know inside out, it's front of mind for you. Who is this group of clients? And then give us about 8 bullet points about what are the skills those workers need. Give it a go. Thank you very much. So I know some of you have finished that because you're really quick. I know some people didn't start it, which is fine, and some people will want a little bit more time, and there's going to be time for that. I just thought I should also take the opportunity, because you're going to keep on training in the meantime, just to make sure that everybody in the room does know that Careerforce currently has a program where we are investing back into the sector. It's called the Assessment Support Program. It's worth about an additional $4 million. It certainly hasn't all been spent, and if you are doing training, if you're training your workforce and you don't know about the assessment support program, then please contact Careerforce, because we'd love you to have your share, because we'd love you to be training your staff and having them recognised. We also encourage you to become a shareholder of us. We are a company. We don't give you any money back for being a shareholder, but you do get all the other benefits of being a shareholder. And we also just reasonably new is we've got a new literacy program that we started called Skills Boost. So that's, just a wee advert in terms of what you can access from Careerforce right now in terms of training supports. So the very last, as I said, and sorry, it's right down the bottom of the slide, but there's our email address. It's www.careerforce.org.nz. And now I'm going to be really cheeky, because as you can probably imagine, having spoken with lots of people and had lots of people fill in lots of different feedback forms, we've realised that we are struggling to read some people's writing, to the point that we're really stuck on actually what some people said when they filled in the form. So I'm going to ask you, because it's not going to take you very long at all, would you please email back to us what you've written on your sheet so that we can actually make sure that we have got the correct interpretation of what you're saying with your writing. And at the same time, I will say, if you have written your email address to us and you haven't heard back from us, it might be because we couldn't decipher your email address when you wrote it in one of our meetings. So if you're feeling that you've been snobbed by Careerforce and we didn't love you after all and we didn't send you back what we said we'd send you, could be because we haven't actually managed to figure out your email address. Most of you we did get right, but I've got to confess there's about 20 I haven't got a clue what they're meant to say. So as I say, I'm being really cheeky. I am going to ask you, if you're interested in this, you're going to do one of two things. You're going to go and click on the website and get yourself onto an advisory network. Now, our advisory partners, so to speak, is, as you can see up there, we have a kind of partnership in this with the New Zealand Aged Care Association, with the New Zealand Home Health Association, with the New Zealand Disability Support Network. We have the New Zealand Council of Christian Social Services being our key contact organisation for social services. We have Platform, and we also have a contact with the DHB, and we're kind of stretching them into Ministry of Health, ACC, MSD, etc. So someone from each of those, and we had to cut the cake in some way, so we went by sector for our working group. There will be someone on the working group who is representing the very widest sphere you can imagine of those sectors. And it's that advisory group or network, that you might want to be involved with. So that's one thing you can do, and the other thing you can do, you could just send us back that form, and so that we can decipher it and read it, and we will add it into our client maps that we take to the table at the very first working group meeting, which is in May.
Jill, can you just go back to that last slide, please? The slide before that, thanks.
That slide?
That's it.
So I think I need to stop now because we need to move on. If you have any questions, I've actually got to go to another meeting, but I'm really easy to find at Careerforce. So I'm Gill with a G, and I've been there for a while, so my name does tend to pop up if you do that Google thing, unfortunately. So please just ask, send me an email or contact Careerforce. Really happy for you to be involved, really keen for you to be involved, and thank you so much for giving me the opportunity to be here now. Thank you.